Welcome, ladies and gentlemen, my brothers, my sisters, my friends, fellow viewers. I want to talk today on hypertension, or you call it high blood pressure. Some other people call it BP in short form. I will discuss this morning on that. But first of all, I'm Dr. Harry Njetebu. I'm an expert in medical biochem and therapeutic medicine, PhD. Now, I wish to call upon your attention that I will give a discourse here in pidgin language for better understanding, so that to enable the most common individual in our society to comprehend what I'm going to discuss here. Communication requires better understanding. It's not about grammar, like I always said, big language, use of medical terms and all that. Now, Papa Mami de Masalona, I be Dr. Harinji Etebo, I be a medical expert. We did for some fee for general medicine, we call it medical biochemistry, where I study, I get the PhD for the. Some other side, the way they call and say therapeutic medicine, that one, a program we know they common for society, for Cameroon particularly. But we do them for outside country, where they teach you how to manage health for some other kind of style, and we not only use conventional procedure then, or use pharmaceutical products or techniques and for general medicine. Now today I will talk for now about that secret they call and say high blood pressure. Some people they call and say hypertension. Some one they call and say that man get BP or a woman get BP. Yes, that sick dey so no be sick wey e mean say blood don plenty for your skin, because plenty people dem when they hear high blood pressure they think say your blood don over plenty pass the blood wey be fit get am. No, that one na wrong idea. We get different for high percentage for blood for person skin and high blood pressure. Pressure means say something wey dey use power. So when we talk about power, e dey different like when we talk about blood pressure. For grammar, when we talk about power, e dey different. We talk about blood pressure. No be power for box, na power for wall, for play with blood dey waka for inside my skin. Now, when we come for high blood pressure, wetin we get for know? The first thing we get for know na say e dey for school. They teach you for medical school say high blood pressure na another thing we dey call am say silent killer. Silent killer mean say something wey e fit take your life when you know or you no know. And we get for be careful for community dem, because people dey die sometimes. They attribute am to witchcraft, talk say na juju, that man don sleep die for bed, he just fall, he just die, he don dirty hand, na involvement, na spirit, medium and so on. If you go for babalawo or na a neighbor relatives, is wrong for us to always think like that. Though the possibility dey, but scientifically we no get explanation on that. Now, wetin dey make man dey suffer this sickness na hypertension or high blood pressure. Many different causes and the first thing we get for know na say we get two kind high blood wey dey catch person, wey dey attack person skin. The first one na primary hypertension. Primary hypertension means say you get high blood wey doctor dey no fit know wetin cause am. They no know the actual cause for the high blood pressure. The second aspect na wetin na secondary hypertension, na different type that way. E mean say you get high blood wey some particular other problem don provoke before the high blood come for your skin. For example, if you get things like HIV, you no take your medicine, you no even know say you get am, e can lead to solution wey your BP dey high. You fit get problem like malaria or pregnancy. Even woman dey be with belle, plenty woman dey develop high blood because of pregnancy. Yes, like my video I talk on pregnancy, una will see and see some people they get BP because woman dem when they don't get pregnant. Now, when your system be stressed to an extent, high blood pressure fit come. Under normal circumstances, when you even stress or you take some kind chop them, your blood pressure fit elevate. But when the condition don be persistent, when they do regular checks, it dey continuous. That's how they talk say your blood, you don't be a high blood pressure patient or hypertensive. So we get for try for counteract or cancel that talk the way people they talk am plenty. They think say na only when man dey think for a brain plenty think them. No human being know the way they think. All man they think. If you be say na only thinking because na thinking with the mental dey cause high blood, it means if all pikin dey write exam they forget high blood. All man they take like GC, defense degree, and big professor or scholar, teacher, they all them forget high blood because the reason they think plenty. So more no put and say na overthinking. First thing where the doctor tell you say you get high blood pressure, you start to say no, you be the think you get this person die, that person is sick, wipe that. Always take from your medical professional, your doctor, advice, be very important. Now, when I talk of doctor, I refer to a medical doctor, a medical expert. Not everybody here, doctor, is a doctor in terms of health or medicine. Now, for this high blood pressure, it gets some common causes in the way they cause them way common around we. And some of that thing them would invite them, would do them, would like them, would not know see those things and they cause them. Now, the first thing I will talk about where it comes for causes and for high blood, the first thing I will lay emphasis on my diet. Think the way they put them for your mouth and think the way let me just say for in short form, think the way they chop them. So looking at the thing the way that they cause the high blood for chop, weight is the common. We get for avoid that thing they say bad fat, bad cholesterol. We get 2 or 3 kind different form with fat that they enter for my skin. You get the one where they get them through what you call and say low density lipoprotein, where they like thing where they work it has some kind fat now we call and say bad fat. High density lipoprotein when are the good fat, they will get triglyceride now another form of fat than that. Now what they chop, some chop them they get different kind fat. Fat don't mean say like pork only, no. Oil they will use and cook chop they contain fat. Seed them get fat. Animal then get fat for inside their skin. So get for be careful what they chop, especially animal protein, animal beef meat. Thing wey come out for animal skin, e get plenty fat and most of that animal their fat, almost plenty of it na bad fat. Some people dey run for chop red meat, they say they go chop na wetin? Intestine, towel, hunchback, kandaka or pomo. Think say na here over fine. All that thing then they contain plenty bad fat. We get for avoid them. Kanda itself, go for skin for animal. It get hypodermis. It get adipose tissue. Means say layer wey be made up of fats. So more avoid all that thing. If you want chop kanda, scrape the inside. Intestine na first the most dirtiest part for the animal skin. I contain fat. When you boil that part then for animal, you see and say when you don't cool inside pot, fat they float on top. Now so when you enter your skin, it create problems because it go tight. So more prevent bad fat. Now coming again forward, we go look say another thing and they like so-called groundnut oil, them, soy oil, palm oil, most of those seed oils them. We see that the talk say fine. Most of that thing they say fine, but some of them, like for example, soy oil or most of the vegetable oil, then they change to what you call trans fat. Some bad fat way they provoke high blood, cause heart disease. So more not over the consume that thing there. If you want fry, you want cook, fine oil for use and nothing like extra virgin olive oil, coconut oil. Now fine oil enough for fry. If you want cook, you use palm oil and a good oil. The palm oil bad when you consume am much and when you bleach am na poison. No be food. Like people they chop puff all the fry stuff them where they use palm oil, you are risking chance for hypertension, heart disease and other major problems. Now coming forward, some other things in there apart from those oils where they contribute for high blood pressure, you get underlying problem like you get kidney problem, you get unresolved health challenges. If you get some sick for your skin, we no treat and fine, no say your BP if you go up, and in long term if it cause hypertension. Now, alcohol consumption regularly dey cause diabetes, a way if it turn cause high blood pressure. It dey cause insulin resistance, wey it dey cause high blood pressure. So get for moderate, that means if you dey drink moderately. You drink in moderation. When you drink plenty, you know it be na enjoyment. You know it be na say you know how for drink pass all man. You dey drink so you dey prepare yourself for hypertension and heart diseases. Overweight na another good factor. We get for control weight. I used to tell people and say, look at me, take this here 2 finger, thumb and index finger. When you hold and so the 2, if the first 2 finger they no fit meet up, say as my own the meet. If you are only in meat so you see gap for your own, the first 2 finger they know the meat. No, a sign simple way than that for no say you get overweight. But when you get scale for house, you go check am because weight dey go with height. Weight for person, man wey tall, e no over get problem with weight like man wey e short. So we will check all those things and we'll take am into consideration. And then some other thing dem dey like chocolate, caffeine products wey dey thing wey dey get caffeine plenty. Some plenty painkiller dey carry caffeine. Now we get the like Viagra dem, that thing wey man pikin dey take am make am man pikin skin e stand fine. Energy drinks wey dey give man power like all these reactor dem, all that thing dey like Red Bull dem, na drinks dem that way dey call am energy drink. Una know say e give power for do thing dem, but maybe behold, go look at even for the bottle dem dey write am, dey get caffeine. That caffeine dey no be too healthy. Dey cause nerve problem, dey cause brain problem, dey cause heart problem, dey cause hypertension. E be indisputable. They need argue that one. That's why you see even like for example for things like some of those drinks they write and they restrict. They write and say e no be good for pregnant women and children and people wey dey get heart related problems, hypertensive condition and so on. Disclaimer dey be for some of the products. Now salt, it will be when you take am in excess, it will cause problem for hypertension. But some young medics dey talk say me man no take salt at all. That's a very unsupportive, or I would say wrong idea, because man system needs salt. Most of the chop they chop and they contain salt. Why some man go stop you me no chop salt, they go tell you me drink top. It no go stop you from top. It no go stop you from plantain and other foods them, cocoyam and vegetables. They contain sodium. Salt in principal reason why they just say it worry for high blood now because of its sodium content. Maggi now one of the things we discourage because most of the Maggi, then when you add that on top table salt plus chop their content of sodium, it elevate them. Just imagine say you drink top or juice where you contain plenty sodium, you take bottled water where you get sodium, you chop where they put salt, put Maggi. Then you go take flour product like this thing there for bakery and all those dairies and all those things there they fry and put salt. What you expect? Hypertension supposed to come. So we minimize the consumption for all that kind of thing because it cause BP. And behold, BP, it cause plenty complication. I know also leave out teas because most teas get caffeine. Coca-Cola and its product they get caffeine. Coca-Cola, Red Cola, all that thing they get caffeine, Nescafe. That's why when you take it even affect you, you know if you sleep well. You get insomnia. That means you know if you sleep. Because your nervous system don't be affected. We get for take precaution on all of that. Now, coming to this very hypertension for hospital generally, they give some medicine them. For example, they give ACE, that's ACE inhibitors. For example, we get enalapril. You get example for calcium channel blocker like amlodipine. You get diuretics like ACT. You get beta blockers like atenolol. All that thing them, nifedipine them, they help for do it for regulate your blood pressure. But with research and my practical experience for field, because like here in Cameroon alone, I've done personally. I'm talking on social media. I think I don't check at least if it's small. The number of people have investigated their blood pressure in Cameroon should be at least 2 million. Because I don't do sensitization for almost 8 million Cameroonians. Almost 8 million have been within the whole of Northwest, majority of Southwest, almost every part of Southwest, except you talk about Lebia Alem and part of Indian. Then when you go to Northwest, I've been part of Northwest, Littoral, and even the Western region, programming the Grand North, Southeast, and Littoral for and Center for the future. Now, majority of the people, I don't do the investigation, I see say that they on this medication, but what is happening with people where they for high blood treatment? Most of these people who are on high blood medication, they did neglect, or some of their medical professionals did ignore, I'll call them neglect for check with their kidneys. They neglect for check their hearts regularly. They neglect for check their eyes regularly. High blood dey cause stroke, high blood dey cause heart disease, high blood dey cause kidney damage, high blood dey cause eye damage. You go who your eye dey hot, you no even know say you get high blood because you go for eye specialist, e concentrate for give you glasses. Like some person be tell me the other day say they suffer from retinopathy. You don check am, you never check am. You have to check all those underlying products that conditions that must be checked by the respective specialists. Those most of them dey do am as they be trained, but some dey neglect because they will be eager for to concentrate on selling their glasses. Now, if you take this medication, it's far better than somebody who is not even taking at all. But alternatively, personally, I think I don't be able to reverse over a reasonable number of individuals their hypertension in Cameroon and abroad, internationally even, because I have more than 500 patients out of Africa and part of other African countries that I'm following up. Hypertension, especially secondary hypertension where you get underlying cause, be easily reversible. That's treated to curative level, means say at the treat and so it finish. But primary hypertension, the one we will not know what exactly cause am, that they will lay emphasis on wetin. If you put the person, if you be say a system not dey easily adjust, we put you on regular medication and then we give lifestyle changes, because now the principal part wey be important for hypertension. That's why it be easy for me for cure the hypertension, because I dey target the cause. Do some cases dey wey you know fit easily see the cause. So what I dey call on each and every one of we for do, first, make sure you do regular checks for yourself. You no must wait that way you sick, you fall, they tell you say you get high blood. It is a basic necessity for go for check for hospital. Go hospital, tell doctor say you want check yourself. He go check am, they call am self-request. He go check you high blood, diabetes, heart problem, viral infection, coronary, so other kind of diseases them. Check your immunity, because it will give you a guarantee for live longer. Because when you discover this sickness, especially high blood, early enough, it be easy for handle am. But when you leave them, as blood pressure dey stay, it will create damages for your system. And one thing most of you have not been told now, say wetin, they never tell now, say when you get high blood, from the moment you get high blood, even when you dey on regular drugs where you know they get good lifestyle changes, know say the regular drug is not curing the hypertension. And in the course of that, your eye is degenerating, the damage small, your heart is damage small, your kidney the damage small. If they never tell you before, go and find out. So if you dey on drugs for medical high blood medicine, me no be for more than 6 months you no check your kidney, me no be for more than 6 months you no check your heart, me no be for more than 6 months you no check your eye, because it's at your own risk. Your doctor may tell you and may not tell you, but any good doctor must check those things at least within a range of 6 months. Now we get some other things like rest being necessary, stress management being necessary. When we talk about high blood, try to have sufficient rest. Sufficient rest, it does not mean you sleep. Oversleep, they bring inertia wey instead create problem for my skin. Rest means you be at least 8 hours where you know they do any major physical activity. It means say your reserve energy, it plenty pass the way you use them. That's rest. Now I will also reiterate or emphasize say wetin. Some chop dem dey wey dey help for make me blood pressure dey try for stabilize, because it dey regulate, it dey balance something we dey call inside your skin say electrolytes or ions dem. We get test wey dey call am say ionogram or electrolyte test. It dey tell we something dey inside your skin like potassium, magnesium, calcium, how much you get and sodium and so on. We need for know your skin suppose get a balance of that. Like people wey dey over chop white chop, it will reduce some of these important vital minerals wey you need them for your skin for carry out your normal daily activity. People wey dey over chop white chop them rice, garri, spaghetti, bread, you dey deplete, you dey damage some of that mineral them. And some people dey wey their own high blood na just because their electrolyte dey be imbalance, they get low potassium, low sodium. Because when that thing they overload, your BP more high. Although so potassium and sodium dey fluctuate, when sodium go down, potassium go up, potassium go up, sodium go down. But when you see say magnesium e don low, potassium don low, na thing dem that way, that some of the thing dem that dey provoke hypertension. And some of we dey fear sun like so we zumi dem. You need vitamin D for that sun from morning time from 7 o'clock to 11. E go help you for prevent you problem dem wey concern BP and other many things dem wey dey affect your health. Now coming to the solution for this high blood pressure, some chop dem dey help for regulate am. Like you get watermelon, you get banana, but that one dem fine na for people wey dey no get blood sugar problem, diabetes. But if you get sugar problem, you avoid that one dem. But pear na another very good source wey dey help for provide you magnesium, potassium dem wey go help for stabilize, for regulate your ionogram. So make we take precaution on all that. E go make we will fit live long. People wey dey overgo chop for Tantalizer dem, Mr. Biggs dem, bakery, una know say that thing dem una dey chop am, the salt level dey over high and e go make una BP, potential blood pressure patients in future. We no dey condemn that chop there. If you must chop am na your hobby, minimize the intake. But know say those things dey fall under junk foods because they come with a lot of tax, price. You get a lot of health challenges wey you hope for when you consume ready-made foods, refined carbohydrates, sugar, cancer and all that. That's for another day. So summarily, make we always do routine check. Buy a blood pressure machine. They are very moderate prices. Learn how to read your blood pressure. Averagely, man, the blood pressure get for be 120 on 80 millimeters per mercury for average standards. But based on certain factors, it fluctuate. You get value them. You get value for up and value for down when you talk on BP problems. The value for up, that one for up, wey na 120, e get range. The one for down, e get range. But we try for say me always check am, me a blood pressure, the one for up, I dey use na pidgin. I no wan go for scientific aspect. The value for up not suppose for pass 135, 140. The one for down not suppose for pass 89 or 90. Because when you don't pass, it means you don't go for BP condition. Try for regulate am. As well as we know when you get hypertension, when you say your blood pressure high, we also know when you get hypotension, when you say your blood pressure over low. Some of you, if don't tell you say na high blood medicine, this take one tablet for one day. You don't already get experience locally as a farmer or common man say when you take one tablet, their head will be the egg like sign for your own BP. Because you know this so for all man, you take one tablet, go cool. Anytime you get a headache, you don't know whether na malaria dey for your skin, no, you go take now double dosage. Say no, I will take one, e cool. Ma take two, me go fine. You dey do na damage for your system. Because when blood pressure over low, it be very delicate too for your health. So always respect your medical doctor or medical professional advice. Recommended dosage for treatment it be a basic necessity. But for those of you who be willing for get a permanent treatment, meet a good expert, but pass through your doctor if necessary. I say with my experience or anybody of my specialty and experience could tell you say hypertension no be na sick way they tell you say you go build until you die. We have several people who have treated, who have come out from that, especially those with secondary hypertension. So you find if you get the opportunity, you can come around or you meet any person of my specialty or any other good medical expert. He will investigate their condition and give you a solution. For those of you where you get more complication or questions for me, you can drop your question on the comment section. You can as well reach me through my contacts 678081988, 678081988, or 681446125, 681446125. And you can press the share button for your relatives. They also learn, for others to benefit from the knowledge we don't acquire from this, because plenty people no know say una solve this problem for high blood dey come. And before I will leave them, this will begin the way that they take tramadol, that they take reactor. More than also that they prepare for high blood, heart disease, and other complications. Because when you take tramadol, the actor them wey we no get prescription, we no respect doctor dosage, no say thing like tramadol, when you no respect dosage, it will cause you damage for your brain, for nerves, and some other complication, and one of which na high blood pressure and brain problem. As for reactor, na drink and energy drinks, Red Bull and so on, drink am moderately. If you abuse am, just like Nescafe, you abuse am, you have complication which none I will desire, because we always want wellness. That's why we dey out for educate una and for take care for una health. Thank you, and don't forget to press the like button so that you can have access and subscription to have access to more of my videos. Bye bye and have a nice day.